What we have to show you is a complete system of patient handling equipment that will handle a patient as their acuity level changes. As an individual is able to support themselves, we use our stand aid to get the patient into a standing position and minimize the risk of fall. If the patient is unstable and needs additional support, we use our support strap and place that behind the patient's back. But as time goes on, the patient's condition could change and they could require more help. So then we can move on to the stand assist device. So now our patient is not able to pull themselves into a standing position any longer. So we need to use our support vest to help that patient stand. And since we need that additional help to bring that patient into a standing position, we need a motorized device to help pull that patient into a standing position. And over time, of course, the patient can start to lose their ability to even hold themselves upright into a standing position. When that happens, we grab our support strap and we can wrap that underneath the patient and support them. And if a patient even requires further help, then we go on to using our Sling to give that patient complete support. What's important to understand about the stand assist device is that with all of these slings, we still can get the patient to the restroom. So now we require complete support. We bring the leg straps underneath the legs. And connect the Sling to the stand assist. With the stand assist being so small, it's easy for us to maneuver it into the toilet area, even with the complete support of the Sling. But when we require complete support for the transfer, and the patient can no longer tolerate this type of position, then we move on to the full body lift to give that patient complete support. And what's convenient about the Sling is it can still be used with a full body lift for a limited period of time on a patient that requires full support. this is to be used with caution on patients that still are able to go to the toilet that require total assistance for transferring. When an individual can no longer tolerate this type of transfer, then we use our full body sling and completely support them in the transfer process. And now we can transfer the patient with the full body lifting sling if necessary. Simply tuck the sling behind the patient's back, bring the leg straps around the hips and underneath the legs, crisscross the sling, bring the spreader bar up to the patient, connect the loops to the spreader bar, raise the patient into the position and make the transfer.